We will discuss how doctors evaluate conditions related to high calcium levels in the blood, such as primary hyperparathyroidism, PHPT, and familial hypocalciuric hypercalcemia, FHH.
These evaluations are important for confirming the cause of high calcium and guiding treatment.
First, if a blood test shows high calcium, it's important to repeat the test to confirm the result.
Total calcium levels are often used, but sometimes doctors may check a more specific form called ionized calcium. This is especially helpful when other factors, like certain acid-base imbalances, might affect the results. In some cases, people can have normal calcium levels on the surface, but abnormal ionized calcium. Repeated tests are needed to confirm this. Also, looking at past calcium levels helps determine if the condition has been ongoing. For young individuals, a pattern of high calcium might point to a hereditary condition like familial hypocalciuric hypercalcemia. Another critical step is measuring parathyroid hormone PTH levels. Parathyroid hormone controls calcium balance in the body. If both calcium and PTH levels are high, it usually points to primary hyperparathyroidism. About 80 to 90% of people with primary hyperparathyroidism have elevated PTH, but in others, PTH may be normal, yet still inappropriately high given the calcium levels. In contrast, low or suppressed PTH can indicate other causes of high calcium unrelated to the parathyroid.
Doctors may also check how much calcium is being excreted in urine over 24 hours.
This helps differentiate primary hyperparathyroidism from familial hypocalciuric hypercalcemia. For example, if urine calcium levels are high, primary hyperparathyroidism is more likely. If they are very low, familial hypocalciuric hypercalcemia or vitamin D deficiency might be the cause. A specific calculation called the calcium-to-creatinine clearance ratio further clarifies this, especially when levels fall in a borderline range. Vitamin D levels are another piece of the puzzle. Vitamin D deficiency can mask primary hyperparathyroidism or mimic it. Restoring vitamin D helps clarify whether the elevated calcium and parathyroid hormone are due to primary hyperparathyroidism or secondary to the deficiency itself. Doctors are cautious with vitamin D supplements in people with suspected primary hyperparathyroidism, as it might worsen calcium levels in the blood or urine. In more complex cases, genetic testing might be suggested. This is particularly relevant for young patients, those with a family history of similar conditions, or when the calcium PTH findings are unclear. Genetic tests look for mutations in specific genes associated with familial hypocalciuric hypercalcemia or other familial syndromes affecting the parathyroid.
Through this step-by-step approach, doctors can pinpoint the exact cause of high calcium levels and tailor treatments to the patient's needs.